In cardiac arrest, the child's heart stops beating. Fortunately, most children have healthy hearts, and cardiac arrest in children is rare. When it does happen, it is most commonly a result of asphyxia, a lack of oxygen that occurs when breathing slows or stops. After completing this lesson, you should be able to recognize the difference between secondary and sudden cardiac arrest, explain the pediatric chain of survival concept,
Help me! Please!
Oh! What happened? Did she drown?
Yes!
Okay, I have a first aid kit.
Ellie! 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 Ellie!
You okay? You okay?
Ellie!
Call 911.
Please, Ellie!
Let's get the vest off.
Are you okay?
Hi,
Ellie,
we're out of Marshall's Island.
She's not breathing.
She's not breathing.
I'm beginning CPR.
He's gonna begin CPR.
Ellie, daughter!
They're on their way for her.
While uncommon, sudden cardiac arrest can and does occur in children of all ages. More often, though, cardiac arrest in a child results from asphyxia, a lack of oxygen that occurs when breathing slows or stops. The lack of oxygen causes the heart to stop within minutes.
Please help us!
They got a notification by phoning in AD.
Causes include airway obstruction, lung infections or diseases, drowning, choking, and shock resulting from injuries, such as motor vehicle accidents, burns, falls, and child abuse.
To bare skin, exactly as shown in the pictures. Do not touch patient. Analyzing heart rhythm. Everyone clear.
Clear.
Press flashing button. Shock delivered.
Prevention is critical in reducing pediatric cardiac arrest deaths. Prevention includes the use of essential safety equipment, such as child passenger safety seats and bicycle helmets, and proper supervision. In this CPR and AED class, a child is defined as 1 year of age until the onset of puberty. Puberty can be identified by breast development in females and the presence of armpit hair in males. For those with signs of puberty, provide adult CPR. The pediatric chain of survival consists of a series of 6 interdependent links that describe the best approach to cardiac arrest care. Each link in the chain is essential for the most positive outcome. If a single link is missing, the chances for survival are greatly reduced. The chain of survival consists of prevention of causes of cardiac arrest, prompt activation of EMS, immediate high-quality CPR and defibrillation, advanced resuscitation, effective post-cardiac arrest care to hospital, and recovery. The greatest chance for survival exists when all the links of the chain of survival are strong.
Complete this review question to check your knowledge. Assessment of the scene and the child is a critical skill that applies in any emergency. The steps of assessment are crucial in determining the provider's next actions. If an unresponsive child is not breathing normally or only gasping, immediately start CPR, beginning with chest compressions. High-quality chest compressions are the foundation of high-quality CPR. After completing this lesson, you should be able to identify the child assessment steps.
There are three main elements of the pediatric CPR and AED procedure: assessment of the scene and child, actions based on the presence or absence of normal breathing, and use of an AED. First, assess scene safety. Upon arrival and before anything else, pause to make sure the scene is safe for you and the child. If the scene is not safe, do not enter it until hazards have been minimized or eliminated. This includes taking standard precautions. If the scene is safe, assess responsiveness. Tap the child and ask loudly, "Are you okay?"
Are you okay? Hey!
If the child is unresponsive, call 911 to activate EMS using a mobile device or activate your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED.
Go get the AED and the first aid kit. I'm checking for breathing now.
Assess breathing. Look at the child's chest and face for signs of normal breathing. Look for the chest to rise and fall. Weak, irregular gasping, snorting, snoring, or gurgling is not normal breathing. It is a sign of cardiac arrest. Take no longer than 10 seconds to assess breathing. Then, take action based on the presence or absence of normal breathing. If the unresponsive child is breathing normally, maintain an open airway. To protect the airway, place the child in the recovery position. Regularly reassess scene safety, responsiveness, and breathing. Stay with them until someone with more advanced training takes over or EMS arrives. If the unresponsive child is not breathing normally or only gasping, and you are alone, immediately start CPR, beginning with chest compressions. Immediate CPR with an emphasis on effective rescue breaths may provide the only chance for survival. If you are alone without a mobile device, give 2 minutes of CPR before leaving the child or carrying them with you to get an AED and activate EMS or your EAP if you haven't done so already.
As in the adult procedure, high-quality chest compressions are the foundation of high-quality CPR for children. To deliver child chest compressions, position the child face up on a firm, flat surface. If the child is face down, carefully roll them over. Position yourself at the child's side, kneeling close to one side of the chest. For child compressions, place 1 or 2 hands on the center of the chest. For a small child, 1 hand may be enough. Position your shoulders directly above your hands and straighten your arms to lock your elbows. Whether you use 1 or 2 hands, push hard, straight down, using your upper body weight to compress the chest at least 2 inches or 5 centimeters. At the end of each compression, lift all your weight off the child's chest, allowing it to completely recoil or rebound to its normal position without losing contact with the chest. Avoid leaning on the chest between compressions. Complete chest recoil allows the heart to refill. Compress the chest at a rate of 100 to 120 compressions per minute. Minimize interruption in chest compressions.
Complete this review question to check your knowledge. Rescue breaths are extremely important for children because cardiac arrest typically results from asphyxia. After completing this lesson, you should be able to explain the importance of child rescue breaths, explain how to open a child's airway using a head tilt chin lift.
Rescue breaths are extremely important for children because cardiac arrest typically results from asphyxia. As with an adult, there must be an open airway to give rescue breaths to a child. The method to open the airway is the same: head tilt, chin lift. CPR providers should avoid giving too many breaths or a large volume during rescue breathing because it can be harmful. It can force air into the stomach, causing regurgitation of food, liquids, or vomit into the airway. Take standard precautions when providing child rescue breaths. Use an adult or child-sized CPR mask with a HEPA filter when available. To use a CPR mask, position yourself at the person's side. Place the mask flat on the child's face, with the top of the mask over the bridge of the nose. Use your thumb and forefinger to provide uniform pressure around the top of the mask. Use the thumb of your hand lifting the chin to control the bottom of the mask. Hook the fingertips of the hand controlling the bottom of the mask under the bony ridge of the jaw. Open the airway with a head tilt chin lift maneuver. Tilt the head and lift the chin to open the airway. Lift the child's face up into the mask to create an airtight seal. Give a rescue breath by blowing through the valve opening. Each breath is 1 second in length. Give enough air to create a visible rise of chest, but no more. Stop your rescue breath as soon as you see the chest rise. Remove your mouth and let the person exhale.
Complete this review question to check your knowledge. When indicated, an electrical shock passed through the chest can restore the heart's normal contractions. After completing this lesson, you should be able to identify the steps to use an AED trainer on a child.
Most AEDs are designed for both adult and pediatric use. The energy level of the shock for pediatric use is reduced from the standard adult energy setting. The shock is reduced by an electronic device built into the AED and activated using a button, key, or another type of switching mechanism. Pediatric pads are recommended for children below 8 years of age. If the child pads are not available, use the adult pads. The standard adult shock will be higher, but a higher energy shock is better than no shock at all. Do not apply pediatric pads to persons 8 years of age and older because the energy level of the shock will be too low. Turn on the AED and bare the child's chest.
Remove all clothing from patient's chest.
If there is a button, key, or another type of mechanism for switching to child use, activate it. Peel the pads from the backing sheet one at a time and place each according to the pictures. Some pads require a front and back position. Others require a left-right position. Press the pads firmly in place. Do not allow them to touch each other. When the AED voice prompts you,
Do not touch patient.
clear the child and allow the AED to analyze the heart rhythm. Be certain that no one is touching the person. If the AED advises a shock, it will prompt you to clear the person again.
Everyone clear.
Loudly say, "Everybody clear," or something similar.
Everybody clear.
For most AEDs, delivering a shock is done by pressing the shock button. Deliver a shock.
Shock delivered.
Once a shock has been delivered, immediately resume CPR, starting with chest compressions. After about 2 minutes of CPR, the AED will prompt you again to analyze the heart rhythm. Follow the voice prompts. Continue CPR and AED use until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways.
Complete this review question to check your knowledge. One pediatric CPR provider can provide high-quality child CPR by putting together all the skills of assessment, chest compressions, airway, breathing, and AED use. After completing this lesson, you should be able to apply the CPR AED links of the pediatric chain of survival as one provider.
One CPR provider can provide high-quality CPR by putting together all the skills of assessment, compressions, airway, breathing, and AED use. First, assess scene safety, taking standard precautions. If the scene is safe, assess the child's responsiveness.
Hey, are you okay?
If the child is unresponsive, call 911 to activate EMS using a mobile device or activate your EAP. After activating, and unless they are readily available to you, send someone to get the first aid kit and AED. Assess the child's breathing for no more than 10 seconds. If the person is not breathing normally or only gasping, start high-quality CPR. Position the child on a firm, flat surface. Perform 30 high-quality chest compressions. Position 1 or 2 hands on the lower half of the breastbone. Use upper body weight to compress. Compress at a rate of 100 to 120 times per minute. Allow the chest to fully recoil at the top of each compression. Use a CPR mask to give rescue breaths. Open the airway and give 2 rescue breaths. Ensure each breath is 1 second in length and creates visible rise of the chest. Immediately resume high-quality chest compressions. Perform 2 minutes of CPR. If you are alone without a mobile device, give 2 minutes of CPR before leaving the child or carrying them with you to get an AED and activate EMS or your EAP if you haven't done so already. As soon as an AED is available, power on the AED.
Adult mode. Remove all clothing from patient's chest.
Bare the chest. If there is a button, key, or another type of mechanism for switching to child use, activate it. Use pediatric pads for children below 8 years of age. Correctly apply the AED pads according to the pictures. If the child pads are not available, use the adult pads. When the AED voice prompts you,
Touch patient.
clear the child to allow the AED to analyze the heart rhythm.
Analyzing heart rhythm.
If the AED advises a shock, make sure no one is touching the child.
Press
Everybody
flashing
clear.
button.
Deliver a shock.
Shock delivered.
Once a shock has been delivered, immediately resume CPR starting with chest compressions.
Chest compressions to the beat.
After about 2 minutes of CPR, the AED will prompt you again to analyze the heart
Do
rhythm.
not touch patient.
Follow the voice prompts. Continue CPR and AED until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways. If another CPR provider is available, take turns providing compressions. Switch providers about every 2 minutes, sooner if they get tired. Try to minimize interruptions to compressions to less than 10 seconds.
Complete this review question to check your knowledge. A CPR provider may face some circumstances that require additional considerations or tasks for effective cardiac arrest care. Act quickly if anything affects AED use to keep this link in the chain strong. After completing this lesson, you should be able to identify special considerations for the AED, describe how to give mouth-to-mouth rescue breathing to a child,
A CPR provider may face some circumstances that require additional considerations or tasks for effective care. Act quickly if anything affects AED use to keep this link in the chain strong. Do not use an AED if the child is immersed in water. The child must be removed from water before using an AED. As in a wet setting, such as lying in snow or ice, in rain, or on a wet floor or deck, or in a small puddle, it is safe to use the AED. If the child's chest is wet, quickly dry the chest before applying pads. AEDs can be used safely on metal surfaces, such as gratings or stairwells. Make sure the pads do not directly touch any metal surface when the AED is powered on. If the AED pads are not in contact with metal jewelry, the jewelry does not have to be removed. Resuscitation puts CPR providers at an increased risk of occupational exposure and infection from bloodborne and airborne pathogens. CPR providers should routinely take standard precautions during resuscitation, including using a CPR mask with a HEPA filter when available. To give mouth-to-mouth rescue breathing to a child, open the airway with the head tilt chin lift. Pinch the nose closed with your thumb and forefinger. Take a regular-sized breath and seal your lips around the victim's mouth, creating an airtight seal. Give one breath over 1 second. Give enough air to make the chest visibly rise, but no more than that.
Complete this review question to check your knowledge. prescription opioid misuse has become a leading cause of unintentional injury and death among adolescents and young adults in the United States. After completing this lesson, you should be able to describe the child CPR AED procedure for suspected opioid-associated emergency, OAE.
Prescription opioid misuse has become a leading cause of unintentional injury and death among adolescents and young adults in the United States. If you suspect a child has overdosed on a prescription or illicit opioid, follow the procedure for pediatric CPR and AED. Give naloxone as soon as you can, but do not delay CPR to give it.
Complete this review question to check your knowledge. When a severe airway obstruction occurs, the child cannot get air in or out of the lungs. This is a life-threatening medical emergency. If the foreign body is not removed, the child will quickly become unresponsive and suffer a secondary cardiac arrest within minutes. After completing this lesson, you should be able to describe how to recognize and provide treatment for a choking child.
A child can experience mild or severe airway obstruction due to an object stuck in the upper airway. If the child can inhale and exhale, encourage the child to continue coughing. Watch for signs of the airway obstruction becoming severe. When a severe airway obstruction occurs, the child cannot get air in or out of the lungs. This is a life-threatening medical emergency.
Okay. Are you choking?
If the foreign body is not removed, the child will quickly become unresponsive and suffer a secondary cardiac arrest within minutes.
Okay, let's sit down. Let's take a deep breath. You okay?
Signs of a severe airway obstruction include the inability to speak, a weak cough, or no cough at all. The child may make a high-pitched noise when trying to inhale or make no sound at all. They may hold their hands to the throat. Ask, "Are you choking?"
Okay. Are you choking?
If the child nods yes, or is unable to speak or cough, act quickly. If you are not alone, have someone call 911 to activate EMS using a mobile device, or activate your EAP. Stand behind the child. If needed, kneel. Reach around and locate the navel. Make a fist with the other hand and place it thumb side against the abdomen, just above the navel and below the ribs. Grasp your fist with the other hand. Quickly thrust inward and upward into the abdomen. Repeat. Each thrust needs to be given with the intent of dislodging and expelling the object. Continue until a person can breathe normally or becomes unresponsive. If the object is expelled and there's a good air exchange, the child should be seen by a healthcare professional. Infrequent but serious complications from abdominal thrusts can occur. If the child becomes unresponsive, carefully lower the child to the ground. Begin CPR starting with compressions. Before opening the airway to provide rescue breaths, open the child's mouth wide. Only if you see an object, remove it with your fingers. Don't stick your finger blindly in a child's throat and attempt to sweep out an object. This can cause injury or push the object further down the throat, worsening the obstruction. If you are alone without a mobile device, give 2 minutes of CPR before leaving the child or carrying them with you to get an AED and activate EMS or your EAP if you haven't done so already. Continue until another CPR provider, someone with more advanced training, or EMS providers arrive and take over, or until the person starts breathing, moving, or reacting in other ways.
Complete this review question to check your knowledge.